Hi friends, I am Dr. Pratap Sator. I have done MD in Pharmacy Medicine. In today's video, we continue with asphyxiants poisons, asphyxiant gas poisons. In that, we'll discuss about sewer gases. So, hydrogen sulphide in combination with methane, nitrogen, hydrocarbons, ammonia and carbon dioxide formed in sewers all are known as the sewer gases. So, sewer gas includes hydrogen sulphide, methane, nitrogen, ammonia and carbon dioxide. Coming to hydrogen sulphide, which is the commonest form of gas which is formed in sewers. It is a colorless, heavy and flammable gas. It has a odor of rotten eggs which is detected at low concentration up to 25 ppm. At higher concentration, the sense of smell is rapidly paralyzed and the person will not be able to detect the rotten egg smell. So, at above 50 ppm, the rotten egg smell is lost. It is formed during decomposition of organic substances containing any sulfur. So, any organic substance which contains sulfur when decomposed releases hydrogen sulfide gas. It is often found in large quantities in sewers, septic tanks, coal mines, well cesspools, private vaults and tannery vaults. It is also occurs in glue factories, gas workers, in the distillation of petroleum oils, in manufacture of artificial silks and other industries where sulfur compounds are used. It is heavier than air, so it gets accumulated in the lower lying areas, mainly the closed spaces like sewers, wells, etc. Normal tolerable limit is about 20 ppm and levels more than 100 ppm is dangerous to life. Coming to mechanism of action, it does not combine with hemoglobin per se, but it does so with methemoglobin to form sulf-methemoglobin. H2S also hydrogen sulfide also interfere with cellular respiration by inhibiting the action of cytochrome oxidase, which leads to cell death because oxygen is not utilized by the cells because of inhibition of cytochrome oxidase enzyme. Coming to signs and symptoms, in great dilution, there is feeling of dullness and sleepiness, and that usually occurs during sleep without any victim regaining consciousness. So, usually a person whenever he works in the sewer gases, because of inhalation of hydrogen sulfide, the person usually becomes drowsy and sleeps, and in the unconsciousness he dies without any realizing that he is poisoned. In weak concentration, there is cough, giddiness, nausea and feeling of oppression. The breathing is labored and heart irregular. Cyanosis of the face, inflammation of conjunctiva, lacrimation, photophobia, muscle weakness and prostration occurs. In moderate concentration, there is metabolic acidosis, secondary to anabolic metabolism, which results in CNS, respiratory and myocardial depression. There may be delirium, convulsions and coma. Death usually occurs because of asphyxiation because of respiratory paralysis. If breathing in concentration of more than 0.1 to 2% of atmospheric oxygen condition, death occurs immediately from paralysis of respiratory centers. Coming to chronic poisoning, it's seen in persons who work in the sewers or wells chronically. So, chronic level, low level exposure may be associated with reduced lung functions and neurophysiological abnormalities such as headache, depression and personality changes, and chronic eye irritation is seen. Coming to treatment, the patient must be removed into the fresh air, artificial respiration and 100% oxygen is started. Later on, hydrogen sulfide has to be excreted, which can be excreted by formation of sulfur-methemoglobin, which allows the non-toxic sulfate into thiosulfate, which is filtered by the kidneys. Amyl nitrates is usually given, which converts into sulfur-methemoglobin, which helps to formation of sulfur-methemoglobin and conversion into sulfates and thiosulfates. Come to postmortem appearance. Usually there is rotten egg of smell is present when the dissection is started. Rotten egg smell may be given off. General signs of asphyxia are present like cyanosis, hemorrhages and congestion of organs. Color of blood and viscera and bronchial secretion is greenish purple in color. Coming to circumstance, most of the poisoning is always accidental, especially in sewer workers. Hydrogen sulfide is sometimes implicated in suicides in Japan, which is been reported. Local bedside test can be done by filter paper which is moistened with lead acetate if exposed to air produces blackening of paper, which indicates that there is hydrogen sulfide is inhaled by the patient. Coming to next sewer gas is the methane. Methane is produced by decomposition of organic matter in the well during summer, which produces methane or marsh gas. In diffuse daylight, a series of reaction takes place with chlorine, successfully replacing 4 hydrogen atoms in methane to form vapors such as chloroform, carbon tetrachloride, both which are seen as depressants. In presence of air and light, the chloroform derived from marsh gas is slowly transferred into carbonyl chloride, which is extremely poisonous gas. Other severe gases includes sulfur dioxide, which is a direct respiratory irritant causing severe bronchospasms and inhibition of muscular transport. Next is nitrogen oxide, which is commonly known as laughing gas and is also used as an anesthetic. These are my references. Thank you.